First tonight, the agonising predicament facing hospices treating the terminally ill whilst losing much needed money. The Garden House Hospice in Letchworth is busier than ever, it says, because of the coronavirus pandemic. As well as palliative care, staff are on hand to help carers and families, providing occupational therapy and bereavement support. But all that is being put at risk because the lockdown has forced its shops to close and fundraising appeals to stop, leading to a loss of £25,000 a week. Our reporter John Ironmonger has spent the day at the hospice.
Time to suit up for the inpatient unit. In here, every patient could be infected and every precaution has to be taken.
We are getting patients who we know have a diagnosis of COVID or are suspected COVID, but as people aren't being tested, we're having to wear protective personal clothing and equipment. We're going to miss having you here.
At the end of life, just holding hands is a comfort. But contact is limited now, and Len is going home today to be with his wife.
Just communicating with our patients has been really quite challenging. People maybe have got some hearing problems or difficult to communicate, and you feel that you have to raise your voice. We're not touching people as openly and easy as we normally would.
These are the people who care when there's no chance of recovery.
We're just about to go into this lady's room here to do some care.
Garden House Hospice sees up to 1,000 patients a year on wards in the day centre and in the community.
Hello, Rowena.
The COVID crisis has thrown its future into doubt,
Actually pop them through, that would be better.
but not for want of help from the public.
That was a local private school who were kindly offering donations of PPE equipment, of the safety goggles and gloves.
And they just called you out of the blue to offer them?
Absolutely, yeah, people have been amazing.
We're going to have hot chocolate.
With fundraising halted during the epidemic, staff are doing more with less, taking patients from local hospitals to relieve pressure on the NHS. Has everyone been taking good care of you?
Absolutely. They believe in me. That's very good.
They believe in you?
Yeah, because you see, I need to get strong.
Visiting is restricted to one person per family member per day.
She has terminal lung cancer. She's been sort of living on her own at home with some continuing care, but the last couple of weeks she's not been able to cope so well, so she's come in here. Obviously it would be nicer if she could see more people, but obviously that's not possible at the moment.
Hayley and Diane are off to make house calls, the same as always, with greater risk.
They're all palliative, they're all end of life. They need that extra support, so being able to kind of touch them and reassure them has been really difficult, and obviously they can't see behind our masks, so they don't really know, what you really look like or what you're doing under that mask.
Palliative care is only a small part of the hospice's work, but the many exercise and therapy sessions have been cancelled, as well as grievance counselling. To put it bluntly, not everybody can say goodbye to their loved ones in the way they'd want to anymore, can they?
For the families that can't see their loved ones and then they die without them having said goodbye, I think it's traumatic, and I think it's something that will stop people being able to process natural grief feelings in the way that we might normally.
Coronavirus has put hospitals and care homes in the spotlight, but end of life doesn't deserve to be an afterthought. John Ironmonger, BBC Look East.